Hello guys, welcome back to Clinically Clear. So today let's cover another very important respiratory infection, that is rubella, also known as German measles. Okay, just like how we did for measles, we'll divide it into three: agent factors, environmental factors, host factors. It is a respiratory infection. So environmental factors most common in winter. Agent factors, causative organism is rubella virus, again a single stranded RNA virus. Reservoir here, rubella, you have clinical cases, and 50 to 60% you have subclinical cases. So iceberg phenomenon is very predominant. What are subclinical cases? Basically symptoms are very mild or asymptomatic. So what is an iceberg? Iceberg, only the tip of the iceberg is seen, right? So just like that, majority of the cases are subclinical, only few of them are clinical. That's why it's known as iceberg phenomenon. So the reservoir or the source, only human reservoir, but clinical cases as well as subclinical cases. The period of communicability is 7 days before and after the onset of rash. Just like measles, which is -4 and +4, here you have -7 days and +7 days from the onset of rash. Period of communicability. The mode of transmission, it is a respiratory infection, so infected droplet nuclei, and the incubation period is for 2 to 3 weeks. That is about agent factors. So what all? -7 days +7 days onset of rash, period of communicability. Single stranded RNA virus rubella. Clinical cases and subclinical cases. In measles, subclinical cases were absent. Incubation period 2 to 3 weeks. Respiratory infection, droplet nuclei. Host factors. Here in age, developing countries between 3 to 10-year-old children, developed countries after the age of 14 is where you will see rubella. And immunity after attack, it is lifelong immunity, just like measles. So these are the epidemiological triad factors. So developing countries 3 to 10 years, developed countries more than 14 years. Clinically, rubella is like a 3-day fever. It's known as a 3-day fever like sickness because very short illness, short duration, not that severe, but why it is very dangerous, I'll come to soon. So prodromal stage, you'll have a flu-like illness. You'll have fever, cough, coryza, runny nose, all that stuff. Then you'll go high. Then you'll have cervical lymphadenopathy, post-auricular lymphadenopathy, cervical lymphadenopathy, and you can have rashes, small itchy rashes on the face, which eventually progresses to the rest of the body, just like measles. But what's important here is the lymphadenopathy and 3-day fever-like sickness. But why is it so dangerous? Because of congenital rubella syndrome, torch infection, R is for rubella. So congenital rubella syndrome is basically, what is congenital rubella syndrome? Newborns with defects secondary to maternal intrauterine rubella infection. So the mother is infected with rubella that causes certain teratogenic effects. It leads to organogenesis defects in the newborn, and once the fetus is infected, throughout the period of gestation and for years after birth, the fetus will have the infection, rubella. This is known as congenital rubella syndrome. How do I diagnose this? Immediately after birth, in the newborn baby, IgM antibodies against rubella will be present, and the IgG antibodies against rubella will persist for even more than 6 months. See, within 4 months, if the IgG antibodies go away, it can just be mother's IgG antibodies that have crossed the placenta and come to the newborn baby, right? But no, IgG persists even after 6 months, and IgM just after birth. Congenital rubella syndrome. The triad for congenital rubella syndrome is extremely important. 3 things: cataract, sensory neural deafness, and patent ductus arteriosus. Cataract, sensory neural deafness, and cardiac defect, that is patent ductus arteriosus. What is important in congenital rubella syndrome? Just because the mother has rubella does not mean fetus will have congenital rubella syndrome. If the maternal rubella is in early first trimester, only then you have a high risk of congenital rubella syndrome. 4 to 8 weeks, if the mother gets infected, 80% chance. 8 to 12 weeks, see the drop, 25% chance. 12 to 16 weeks gestation, 10% chance. More than 16 weeks, after 16 weeks of gestation, even if the mother gets rubella, congenital rubella syndrome won't happen. So basically, what is the inference from this? Early first trimester infections, the rubella, maternal rubella infection will lead to congenital rubella syndrome. So 80% in the first 4 to 8 weeks of gestation. That is extremely important, and this can lead to congenital rubella syndrome. What we want to do, we want to prevent and control this. So active immunization is rubella vaccine. Just like measles vaccine, it is a live attenuated freeze dried vaccine. It gives you lifelong immunity. MR, it is given along with measles, right? So same dose, 0.5 ml, subcutaneous. Same schedule as measles vaccine, 9 months first dose and 1.5 years second dose. The strain here is RA27/3. Just like measles vaccine, it is temperature sensitive, so stored in cold chain, 2 to 8 degrees Celsius, dark bottle. Contraindicated in pregnancy, torch infection. Why will you give rubella vaccine to a pregnant woman? It is a live attenuated vaccine. So immunocompromised children you will not give, HIV children you will not give. And just like measles vaccine, you will give advice saying that no tuberculin sensitivity test for 4 weeks, no, do not plan pregnancy for 4 weeks after receiving the vaccine, and do not give the child any blood products for 3 to 6 months. Do not, avoid giving. Understood? So live attenuated freeze dried, same cold chain, dark bottle, strain is RA27/3, lifelong immunity, 0.5 ml subcutaneous, 9 months first dose, 1.5 years second dose. Pregnancy, of course, we don't want to give rubella vaccine. Why? Because it will lead to congenital rubella syndrome. It might immunocompromise. Why will you give live attenuated vaccine to an immunocompromised kid? And advice, most important, is do not plan pregnancy for 4 weeks. Now, never give MR vaccine or MMR vaccine with a yellow fever. That's an important contraindication. And CCID50. The vaccine bottle will have something known as CCID50, that is cell culture infection dose. That is the amount of virus required to cause cytopathic effect in 50% of the cell culture line. Basically, while developing the vaccine, you will culture the virus in certain cells, right? So the amount of virus needed to have an effect, cytopathic effect on 50% of that cell culture line is CCID50. And for MMR vaccine, it is 1000. CCID50 is 1000 units. Uses, of course, active immunization. Rubella outbreak. Active immunization is what? 9 months and 1.5 years, according to NIS schedule. Active immunization to prevent spread of rubella. Rubella outbreak, you will follow priority based immunization. That is, as prophylaxis, first people you'll immunize is women of reproductive age group who are non-pregnant. Not pregnant woman you won't give. Pregnancy is a contraindication for rubella vaccine. Non-pregnant woman of reproductive age group, you will give rubella vaccine. Next, you will give the children, and last, you will give the infants. So, you will sort of follow a triad system, a priority based system during rubella outbreaks. And if the vaccine is contraindicated, then for post-exposure prophylaxis, you can give passive immunization, that is rubella immunoglobulin. That's all. Active immunization and passive immunization. Passive immunization is when the rubella vaccine is contraindicated. For outbreak, you will follow priority-based vaccination. Highest priority is non-pregnant women of reproductive age group, because these are the ones who will eventually get pregnant, and then if they have rubella, it will lead to congenital rubella syndrome. See, this 3-day fever like sickness, it is not a big deal. This congenital rubella syndrome is very dangerous. So we want to avoid that the most. Understood? So that is why we have something known as a global rubella and measles elimination framework. It aims to have 95% vaccine coverage, 95% of the population covered by MMR vaccine, incidence of measles less than 1 per million, and also combat cyclic outbreaks of rubella and measles. So these are 3 aims of global rubella and measles elimination framework. That is it for rubella short video. Thank you for watching.